Welcome back. With us right now from the Saddleback Memorial Foundation are a couple guests that I welcome them back. Well, one of them I just met for the first time, but I know Cecilia Ballou. Here she is down here, the president of Saddleback Memorial Foundation. Welcome back, because it's been a while.
It's been a little while. Thanks for having us.
Yeah, it's fantastic.
It's a pleasure.
And today you brought along Dr. Larry Gersten. And Doctor, you were involved with the Memorial Care Joint Replacement Center at Saddleback Memorial. And I'm going to talk with you first, if that's okay.
Sure,
because then we're going to get into the foundation. You know, as people age, and even some younger folks as well, especially sports-minded and things like that, they often have problems with their joints. And it's not uncommon, but it can be quite painful and annoying. And this is where you come in and the center comes in, right?
Correct. Actually, the arthritis department is probably the busiest orthopedic department in the hospital.
Yeah.
And as people are getting older and the more sports activities, there's really no other treatment for end-stage arthritis than joint replacement surgery.
Yeah.
And I'm happy to say at Saddleback Hospital, we're Medicare certified as a center of excellence, and we perform over 800 joint replacements per year.
Wow.
So we're very, very busy.
So how do you figure out who is a good candidate for joint replacement? And you know, you send me a couple notes here, and the most common are knee and hip, which of course makes sense.
Correct. So originally, joint replacement was designed to reduce pain and improve function. And so 20, 30 years ago, you really didn't want to do more activities, you just want to have less pain and walk better.
Yeah.
Now the expectation has risen to, you're almost back to a normal performer in sports after a joint replacement surgery. But I would like to say that, you know, everybody should start out conservatively. We tell them to exercise, lose weight, take medication, try injections, and then the last treatment is a joint replacement.
Okay. Over the years, there's been just incredible advancements in this, hasn't there? Not only in the material that they use, but the actual surgical techniques, right?
So it's very amazing to me that right now the surgery takes about an hour.
Yeah, that's
and
incredible.
The hospital stay is 1 to 2 nights.
Wow.
And for hip and knee and shoulder replacements, you're in physical therapy the day of surgery. So there's no downtime anymore.
Wow.
So everybody's up. The parts will last for 30 to 40 years. So
really?
whereas they used to last 10 to 15.
Wow.
Now we tell everybody 30 years for a hip or knee replacement.
That's incredible. Now, do you kind of attribute this to the advancements in sports medicine over the years that have kind of, you know, obviously, you know, top-level athletes, but then from there, a lot of the stuff I've seen sort of applied to just your average individual who at a certain age may need something like this, and the materials they use, and they're lighter weight, and it's
well,
incredible.
the materials definitely are longer lasting. The patients are more active than they used to be, and as they get older, they're still in very, very good shape.
Yeah.
And so I tell my patients that nobody is too old for a hip or knee replacement. It's how old you feel and how healthy you are.
Is there an average age?
The average age is about 65 years old.
Okay.
Hip replacements have younger and older patients, so they average between 50 and 85.
Okay.
Knee replacements are more in the 60s.
Okay.
But as time goes on, we're getting younger and younger patients all the time.
Is that because of, did they just have more activity or more arthritis is showing up? What do you find to be the major cause?
So I think because of sports medicine,
okay,
they have injuries now, they tear an ACL, they have a reconstruction, and they're back on the playing field. So as time goes on, they're developing more and more wear and tear and more arthritis.
Okay, tell me about the Imagine Project.
So the Imagine Project is very interesting to me because we want to build private rooms for orthopedic patients. So right now, the patient goes to the 3rd floor and they're on the surgical unit.
Okay.
After this project, they'll be going to the 2nd floor. They'll have their own room. They can bring family members in. They can have,
yeah, that's nice.
We're building a gymnasium down the hallway, so everything will be self-contained.
Yeah, I saw that. That's incredible.
Self-contained in one area. And like I said, they're only there for 1 to 2 nights, so it's a very quick stay. But if you can get a quick start on the rehab, the whole recovery is much, much easier.
Okay. Yeah, I would think so. Everything's right there. And it's just incredible to me that it's really done so quickly now, the recovery time, and obviously they get sent home, they have additional recovery.
The number one
but,
improvement
wow.
in joint replacement is pain management.
Yeah.
So no more narcotics, no more nausea and vomiting. Everybody has anti-inflammatory medication, and they're up and moving right away.
Very good. Now coming up this weekend, you have the Joint Solutions event, and where's that going to take place?
So we have, twice a year, we have a symposium in the basement of Saddleback Hospital in the conference room.
Okay.
And this year, Dr. Montgomery, my partner, will be giving a talk on hip and knee replacement. And they have physical therapists, they have nurses, they have occupational therapy. All the people that are involved in joint replacement surgery will be there to answer anybody's questions.
All right, and that will be from 8:30 to 11:30 coming up this Saturday.
Correct.
The 4th. It's incredible, the advancements, right?
Yeah, absolutely.
So as I mentioned, Cecilia is the president of the Saddleback Memorial Foundation. And, you know, Saddleback and this community have pretty much grown up together,
That's
right?
true.
You
Very
look at old
true.
pictures
Yeah.
years ago, and we mentioned before, this used to be part of Moulton Ranch, and you see this community starting, and you see Saddleback starting, and just fields in between, right?
It is. If you look back, pardon me, I'm losing my voice here, but you know, you look back at the early days of Saddleback, and as you know, this community is about 10 years older than Saddleback itself. And we are always heartwarmed by the thought that residents of this community went around door to door collecting funds to start the facility, which started as a clinic. So of course, you know, 40 years later, we have an amazing hospital that is providing tremendous care, and as you know, reimbursement from all of the payers, including Medicare, continues to decrease both for hospitals and physicians as well. So that gap is filled by philanthropy, which this community has been so philanthropic. In addition to that, you know, we see the fact that without that support from the community, we would not be able to have amazing physicians who use great technology and want to be involved with the newest technology also to have the best outcome for our patients.
And over the years, you've had some great supporters because you are a nonprofit.
Correct.
So if people want to get involved with supporting through the foundation, what's the first step? Where can they go to look at this?
They can always call our office, and we say no matter what the size of the gift is, size is small or large, is really touching the lives of our patients. So if you call our office, we can, you know, set up an appointment, talk to you about the different opportunities, give you a tour of the hospital. Right now we're engaged in this specific project that we are in the 3rd year of raising funds for it, and it's scheduled to probably be completed no later than the fall of 2018. But there are opportunities to, especially at year end, as you look at your tax situation, you might be looking at appreciated stock or IRA transfers. There are a lot of tax advantages to do that, and we definitely have staff in our office that will be delighted to visit with anyone who even has questions about it. Just come have a cup of coffee with us. We love to visit with you.
And they're naming opportunities
They're
as
naming
well. So if
opportunities.
something really is important, you know, maybe years ago or just recently somebody came in and saw you and got their hip replacement and thought to themselves, you know what, that is a great department, I want to contribute, but I'd love to see my money go to that department.
Correct.
They can do that,
Correct.
right?
So especially as we are going through this project, there are a lot of opportunities. There's an opportunity to name one of our new private rooms, the gymnasium that we talked about, lots of great high technology and equipment that can be named as well. This project really offers us a lot of opportunity for naming and recognition. You know, whether you want it public or even anonymously, we work with our donors to make sure that their win is our win.
Right. And of course, as we get to, God, it's hard to say, but the end of the year,
Yes,
we only got 2
almost
more
here.
months.
Yes.
You might want to look at this year, of course, as you check with your financial person
Correct.
and see what's right for you. But you can just give like a one-time gift if you want.
Correct.
Or you can get onto, I guess they're called
pledge.
annuity programs,
Yeah.
a pledge,
Yes,
all kinds of
yes,
different
yes.
things.
There are
right?
a lot of opportunities as you look at maybe funding one specific area of the hospital. The gift might be a little bit larger than what you would want to do in any given year. So you can pledge an amount and
Yes.
pay it off in 3 years, 5 years, depending on the project. We also do offer charitable gift annuities. It's really a great program. We have many of our donors who take advantage of that program live here in the village.
Yeah.
It's guaranteed income for the rest of your life.
Yeah.
So we love to talk to you about it.
Very good. I want to give you the website, memorialcare.org/SMF, Saddleback Memorial Foundation. See, it all fits in. There it is on the screen. The number is 452-3724. Doctor, great to meet you.
Thank you very much.
I hope we see you again. Cecilia, I
Thank
know
you
I'll
so
see
much
you
for
again.
having us again.
I know.
Thank
I want
you.
you to come
It's a
back.
pleasure.
Don't
We
be
will.
away for another year.
We will be back soon. Thank
All
you
right.
so much.
You take care, and we'll be right back.